implementing sustainable change, recognising the context and individuals. So community of practice events are recorded, as you've just heard me saying. We use, for our comms purposes, communications purposes, social media, our reports, we use screenshots that are taken from the recording. If you don't want to be in a screenshot, please keep your camera off, or just pop in the chat and let me know that you don't want to be in the picture, and I will contact you and double check you're not in any images that we might use. As a resource, these community of practices are on our YouTube channel, and we'll get a link to you after the event, so you could look at previous of community of practices as well. So just coming across, you've heard me saying a couple of times now, so the next slide, please. I'd like to say how delighted I am that we're joined by Sabina Stănescu, who's going to introduce herself. So over to you, Sabina.
Hi, everyone. Oh, well, sorry. It's really great to be here. Thank you so much for having me. I'm Sabina, and to start off with, apologies. My throat is still a bit funny. I've had a few weeks of something that felt like COVID and sounded like COVID. It really wasn't COVID. So sorry about that. Yes, I'm Sabina. So I'm a health psychologist by background. I've worked in research for a bit, focusing mostly on long-term conditions and self-management, illness perceptions, quality of life. But it's where I got a lot of the background of what I'm going to talk to you today. I then went into public health, so I've worked in local authority public health for a number of years on a number of different things. A lot of them sort of more NHS linked and more NHS also commissioning. I developed a smoke cessation service, commission health checks, but also have community focusing and public facing, like events and campaigns. And that's where COVID found me. So during COVID, I picked up an incredibly interesting role to implement behaviour science kind of informed messaging and use those to support residents. This was in Southampton, where I was at the time, to support them to follow COVID guidance, do their vaccines, those sorts of things. I then what did I do then? I then had the baby. Then I came back and moved over to Surrey County Council, where I am now in my kind of main day job, where I work on as public health lead on the links between mental health and physical health. So very excited to work there as well. And I think my links to Dorset maybe are that this more or less this whole time I've been a lecturer with ACC University College. So I teach some public health and I teach some psychology, some communication skills, and more recently I've been teaching the FCP on the FCP course. So it's really lovely to be here. I'm very excited to talk to you about some of this theory.
Fabulous. Thank you so much, Sabina. And just quickly, FCP course?
Sorry. First contact practice.
Brilliant. Thank you so much. If we could just have the next slide then, please. The majority of you will have already done this. If you haven't already, please pop in the chat your name, your role, the organisation you work for, you work with, and what you want to get out of this community of practice. And Sabina and I are going to try and cover as much as possible. So we'll be scanning those points that you've actually raised and try and build them into the slides as we go through. So coming next slide, please. Thank you, Emily. So just very, very briefly, it would be remiss of me not to just briefly talk about the Dorset Innovation Hub. This is one of our community of practice events. Dorset Innovation Hub is a network of like-minded health and care and academic partner organisations in Dorset working towards trying to make connections and build existing relationships to promote and facilitate the adoption of, you've guessed it, innovation in Dorset. And really important that we're thinking about what are we doing with the work, the projects that we're doing, and how can we improve what we're doing, and hence why we're looking at behavioural change today as the community of practice. And then next slide, please. So the Dorset Innovation Hub is an integral part of the Dorset ICS, the Integrated Care Service, enabling innovation to connect with the detail of system priorities. So we work on priority projects within the system with the partner organisations, and I'm delighted we're in the latter stages at the moment of signing Dorset Police to join us as well, because we don't think just in health and care, we need to think as a system. The other element is our focus is on deploy, and that is the adoption and spread of proven innovation. So thinking about evidence-based innovation tends to be NICE guidance, so National Institute for Clinical Excellence. And think about where that fits in the golden thread of quality is thinking about the discovery, the clinical research, the inventive innovation. So there's new pieces that say, is it better to treat a patient with drug X or drug Y, moving into the development and then moving into deployment. How do we get innovation into real world practice, and how do we change the practice that we are doing? In other words, how do we work with change and help people and guide people along that path? Next slide, please. Last slide for me before I hand over to Sabina for the main chunk of our community of practice is introducing the Dorset Innovation Hub. So we're like a mini ICP, an integrated care partnership, and you can see on the top left there representatives, voting representatives from each of the partner organisations who oversee our programmes, review risks, look at projects and actually support with regards to the development of how we are being effective with the implementation of innovation in Dorset. And then what we work with the core team, and you'll notice probably some folk from within your organisations in the images, we work with benefit in kind. So we work together, place-based, looking at priority projects and facilitating. So we work with you to support priority projects, working with your organisations for your organisations. And that includes both the strategy, education and governance, as well as providing that practical learning and support. The key for us is it's about how do we improve our population's experience and outcomes. And I'm carefully saying population because it's not just service users, it's about thinking about our population, thinking about preventative health as well. So handing over to Sabina, and then at the end I've just got a couple more slides and a couple more points we'd like to cover as well. So over to you, Sabina.
Thank you very much. So today we want to invite you to think about behaviour change in a slightly, maybe slightly different way. So I will introduce some theory and some examples, and I'll get you to think about some behaviours of your own, and maybe this is not necessarily new theory for some of you, maybe it is for others, but I think it's really important to try and think about in terms of a process. So what this is not even so much of a stop to more of raising awareness to that process and those theories, and there will be resources at the end, and I'll talk you through them about how you can take those resources and you can use some of this theory to develop your own projects and think about how to apply those kind of from start to end. So can I have the next slide, please? Oh, this is very exciting. Yes, so behaviour change has become quite popular more recently, I think, and we've seen a lot of examples. Certainly during COVID, I've got some COVID related examples over the next few slides. I think there are a number of ways in which we try to do behavior change, and it's not always working how we were hoping, or we're not really sure whether it's worked or not in the first place. So I'm hoping this is what we'll invite you to think about and to reflect about of the next slides. Could I have the next one, please? So the idea behind changing a behavior is that we want to get people, whoever they are, whatever that behavior is to get them to either do more of something or less of something, or start doing something that they weren't doing, or not do something that they were doing. This is fairly kind of self-explanatory, nothing new to this point. But what we found over lots and lots of research studies and a lot of work over years is that actually how we think about how we think about the behaviors and how we think about people who do the behaviors is really quite key and quite crucial. And a lot of the time when we see these interventions, is what we call them, they fail because of this definition. So you hopefully understand a bit more as I go on. So a behavior is something we say it refers to the way in which someone acts or conducts themselves. So is an action with some degree, some level of conscious control, and it is linked to how we function. So a lot of things that we do are behaviors. Very interestingly, a lot of things that we think are behaviors really aren't. So what I'm going to do today, and I'm seeing, thank you very much for writing in the chat about what you're hoping to get out of today. So I'll try and wrap all of those up towards the end. But what I focused in the next few slides is on behaviors around, so kind of professional behaviors in a work context. Of course, a lot of this theory has been written and tested or research evaluated in the context of health behaviors and behaviors of sort of members of the public service users. So things like smoke cessation and healthy eating and physical activity and medication adherence, but we can apply them, and they certainly have been over many research studies in terms of work-related behaviour. So let's, Emily, could I have the next one, please? Let's try to do a bit of an exercise, and I want you to tell me if you think, oh, apologies, I lost my screen there for a second. I want you to tell me if you think these are behaviors or they aren't. So let's try to use the reaction. So I'll read them out one by one. And if you think this is a behavior, yes, it's a behavior, then please can I have the thumbs up? If you think this is not a behavior, then please can I have this one? Or any other reaction that you would like. So what do you think? Attending training, is that a behavior? Oh, they look very beautiful at the bottom of the page. Okay, so some are saying yes, it's a behavior, some are saying no, it's not a behavior. Can I hear from somebody who said it's not a behavior? Why do you think it's not a behavior? You can type in the chat if you don't want to come on.
Sounds like people have gone shy. Someone be brave. Can somebody say why they think it's a behaviour? Let's get some interaction going.
I'll come in and say why I think it is a behaviour.
Yeah. Hello.
I just.
Hello, is this Lorraine?
It is, yes.
Hello, Lorraine. My name's David. I'm calling from the George Pub.
Somebody needs to go on mute, I think. There we go. So yeah, I think it is a behaviour. I think attending training, that's something somebody's chosen to do that. They've chosen to go to it. It's an action that's in their choice. So therefore, for me, I think that is a behaviour. I don't know.
That's absolutely right. And thank you. We have in the chat, behaviour implies a pattern, like it needs a time frame. Yes. No, I was going to say yes and no. That's not right. No, it doesn't. A habit needs it to be consistent over time. A behavior strictly is just one action. You can have something that you only ever have to do once, like attending a screening or attending an appointment. It still counts if you've done it just the one time. You don't have to do it every 5 years for it to count as a behavior kind of thing. Let's see, putting your hand up on Teams. Is this a behavior? Can I have a thumbs up for a yes and the little surprised face for no? Yeah, lots of people saying yes, it's a behavior. Exactly in the same kind of way is an action, is how we conduct ourselves. There is some degree of choice and conscious control over putting our hand up. Getting a promotion, is this a behavior? It is not a behavior. Excellent, well done. You got it. Reading the most up-to-date or the most recent guidelines. Is this a behavior? Oh, I've got a hand up. Sorry, I saw the hand go. I couldn't see the name. Please, could you come in?
I might have inadvertently raised my hand, sorry.
Okay. So that is a behavior. Well done. Intending to read emails the first thing in the morning. Oh, we have a bit of both for this one. Somebody brave want to tell me why they think yes or no?
I said no. Oh. Sorry. I said no, and I think it's because it was an intention. There wasn't an action behind it. That was my thinking.
Yeah, well done. Anybody disagree with that? Nope, that's exactly right. Intending to do a behavior is a very strong predictor of behavior, but we do often find something called intention behavior gap, where if you go and ask lots of people if they want to recycle or if they intend to recycle, then a very high number of people are going to say, yeah, absolutely, I really would like to. And then if you look at actually recycling behavior, how many people have recycled, you will see that that is quite a strong, quite a big difference there. Okay, raising concerns with a manager, is this a behavior? Thumbs up all around. Excellent. Yep. How about implementing the most recent guidance? You're all saying it is a behavior. It is a behavior. I think it's the trickiest one for me. It is more of an out. How do you implement something? What does that mean?
Is it because it's more of an action? Sorry,
go on. Say again.
Well, if you're implementing something, it's an action. Sort of, you're taking the action to then sort of implement and, deploy and make the change of, in this case, the most recent guidelines.
Yes. Yes and no, because in implementing something, it's often a series of other behaviors. So it's setting a working group, it's changing a protocol for that, is evaluating this. Only then implement is a collection of different things that different people have to do to come in. So you could have say a list of 10 behaviors, and if only 9 of them are done out of the 10, then you've not really implemented it. It's the specificity. It's like saying eating healthy. What is that? Is made up of many different behaviors that you have to do at least some, but perhaps not all, for that outcome to be achieved.
So it's thinking about the individual elements, it's thinking about the group and the overall.
I think it's one that we face a lot. Why you know, the most recent guidelines, why have they not been implemented? And it comes down to, say in this hypothetical example, if we have broken it down to 10 different things, how many of them are impossible to, which ones have we encountered barriers for?
Okay.
Okay, how about ignoring emails? It's a behavior. Yes, it is. Talking to a colleague over lunch. A behavior. Yep. And having the confidence to present a board meeting. Not behavior. Excellent, you got it. You figured it out. Well done. Okay, let's move on to the next one, please. Okay, so we've talked about what's behavior and what's not behavior. So I would like to think of the next couple of minutes, and I'll try to keep hold of them and read them or talk through them. What do you think is something that needs to change for you? I said in a work context, so, you know, obviously try to keep it confidential and if you think of anything, please can you put it in the chat? Should have probably put that on the slide.
Hopefully people are putting together their thoughts, Sabina. They'll start popping up in the chat in a minute.
Try new things. That's a brilliant one.
Some great points coming through in the chat, aren't there?
Okay, so try to visually summarize and group them a little bit. So the ones that really stuck out for me are around trying new things, and being open to change, and trying new things, and kind of embedding that change, making that change stick. And the other one that I really liked was around listening to people who are experts in a certain issue, which was really, really brilliant. Leaving comfort zone, like that one, I think in a similar kind of way, embracing new things and change and not being resistant to that change. So can I have the next slide, please? If people can, thank you. If people can keep writing those down, and I'll try and make a summary of all of them towards the end. So so behavior change is interesting. We call behavior science a bit of an expansion of behavior change. We've been trying to do behavior change for years, and it worked a bit like this. This needs to happen. We're going to tell people to do it. Then we're going to see if they've done it. They've not done it. We're going to try again. And behavior science tells us that that sort of approach isn't going to work quite like that, because there are so many different things that determine our behaviors. So you very, very, very interestingly and very, very well point out that sometimes there is this resistance to change. And absolutely we'll see that in our patients and service users and members of the public, in our colleagues and our bosses, in policymakers, in people who write the guidelines and so on. So change is difficult, and making change stick is even more difficult. And behavior science tells us that we're never going to get anybody to change anything unless we really understand and we really spend time focusing on what we need to change and who needs to do what for that change to happen. And it's often a lot more complex than we think. So there are about 3 stages. We defined it as about a 9 or 10 step process to implement an intervention, but it really kind of boils down to these 3 questions. And the first one, which is really, really important, and often we skip over it and we go straight to how to do it, solution focused. Let's fix this, without necessarily trying to really understand what we would class as success. So what are we trying to change? What is the behavior at the moment? And what does it need to be? And who needs to change? So this in this kind of theory they're called target behaviors and actors. Actors are people who do the behaviors. Interestingly, a lot of the times, actually, the people that we're trying to improve the outcomes for, the behaviors for, aren't the ones who have to do something different. So I'll talk you through my example in a moment. Then we really need to spend a long time thinking, why isn't this already happening? Why aren't the actors doing the behaviors we want them to do, the desired behaviors? What would make them do this more? And this is something called barriers and enablers. And then once we've really figured this bit out, then we want to know what do we have to do and how will we know if it's worked? So could we go to the next one, please? And that hopefully is my example. It is. Yes. So I told you I'll give you a COVID example. And sorry, my example is this was back at sort of towards the end of 2020. It came out that young people were very much affected by COVID. Schools were closed. They were really struggling. Back then, I was working quite closely with this university in Southampton, and they were doing lots of work with teenagers. And we were putting out lots of information. We're spending a lot of time writing all these messages and all of the guidance for kind of infection prevention, and yet it kept coming out that the young people weren't following quite. We thought they were, or quite how we hoped they were. So we talked to them, and we through these kind of research channels. Essentially, we asked them, well, what do you need? And we came up with it. We came up with this idea. It was actually quite complex, but what it boiled down to is they weren't getting the information through the channels that we were putting it out. So we were using kind of council, social media, Facebook, Instagram, and so on, Twitter, as it was known last time, and the kind of digital ads that went out on the local newspaper website and other things like this. And what it came down to wasn't so much that we needed to enact. We didn't need an intervention for young people to wash their hands and self-isolate if they had symptoms. What we needed is an intervention to change the channels that we were using to communicate with them. So what I needed was a big and really actually quite challenging meeting with the comms department to say, we need a council TikTok. And unfortunately, I didn't get council TikTok at the time, but we did find ways around that, around sharing information with young people. And the reports that we had, the way that we were measuring engagement, the way that we were measuring it changed. But in this case, the actors, the people who needed to change and adopt innovative ways to change, to do things slightly differently, weren't my target population at all. So it wasn't that we needed something for young people. We needed the change needed to happen at that kind of more policy level. So we wrote some papers as well. You can read about that. It's a very, very interesting project from a local authority, public health person. They did some brilliant research at that time. Could I have the next slide, please? So once we've identified the behavior, which can be very simple, like hand washing, COVID guidance is a good way of thinking about doing behavior change, because the behaviors are pretty simple and pretty measurable, and you can use things like SMART goals to think about whether what you're defining as a behavior is measurable and achievable and possible for people to do. So we talked about embracing change as a behavior and getting people to be more open about that, about changing things, about using innovative ways. And that absolutely can be a behavior or is made up of a few different behaviors. So once we've identified who our actors are, who are we trying to get? It can be one group, it can be one person, it can be actually lots and lots of people doing all sorts of different behaviors. But once we've identified this, we want to think about, well, why aren't they doing it? And this is a theory called the Combi model. It is the most popular theory of behavior change, behavior science. It is at the bottom of a lot of the COVID messaging. So stay home, protect the NHS, those kinds of things have been written on the basis of this by a team led by Susan Mickey at UCL, brilliant behavior scientist, probably the best one out there, very likely. And we often think that people don't do things because they don't want to, because they lack motivation. And if only we explained it to them and told them, then they would do it. And it doesn't quite work like that all the time. People, yes, they need to want to do it. They need to be motivated, but they also need to know what they should do, when they should do it, how they should do it. There needs to be an element, a strong element of literacy, having appropriate training, understanding the importance of that behaviour. And a lot of the time, what we see, especially with health behaviours, is a lack of opportunity. So if people don't have the time, if it's not prioritised, if it's not to do that training, then they won't know how to do what they have to do. So they will be less motivated, they will understand less. They all kind of have a knock-on effect on each other. So opportunities are about resources that are available to us to enable us to do that behavior, to facilitate us to do that behavior. So if I live in the middle of nowhere and it's muddy all around me and it's dark half of the day, and I'm a lot less likely to go out running just because of that. Even as motivated as I am, I'm going to be less likely to do that. If I don't have time, if I don't have capacity to attend any extra training, then I'm a lot less likely to want to adopt any change, because that takes time and energy and capacity. And then motivation is about beliefs that we hold, but whether it's within our role to do something, our target behavior, our desired behavior, and what we think that will achieve. So if I really thought that getting a council TikTok will really help get the message out there and really support residents, especially young people, to follow the guidance and follow the infection prevention advice. But the resources I had at the time to enable that were very limited. So I think that was probably one of the biggest barriers that I was facing. Next slide, please. So often it can be one thing that's a barrier and one thing that's an enabler, or it can be any combination. Capability is divided into two, motivation is divided into two, opportunity is divided into two, so it's 6 of them in total, and you can have any number of combinations of what's a barrier and what's an enabler. So Steve, if it's an enabler, then we want to keep it. If it's a barrier, then we want to change it. And based on that, if we know what it is that we're lacking, then we know what we have to put in place. If it's a matter of understanding and knowledge and skills, then we're going to put on training. If it's a matter of motivation, then we want to incentivize, or we want to model, we want to show, enable people, we want to show them the potential benefit that our target behavior, our desired behavior will have. And then we can put that in place at the level that we think it's going to work. So if it's individual motivation, then we can work one-to-one with a person. If it's something around the environment, resources within the environment, opportunities in our environment, then we might want to change the environment surrounding our actor or our target kind of person or group. So we could have things like restrictions in place, or we could have incentivization, we can have training or education, we could have modeling, and you tailor those based on your understanding of why the behavior hasn't happened, as opposed to kind of the other way around. Get the next one, please. So think about, I've put here, think about the complexity of what you're trying to change. A lot of the times when we think about behavior change and we think about what we want to change, we start very big, which is absolutely the way we should start. But actually, we need to break that down into really easy actions and behaviors that we can measure. If you can immediately know if something's happened or not, great. If it's, oh, it's more complicated than that, then you probably want to break it down even further into smaller behaviors. It takes a long time, and it's a pretty lengthy process to understand why a behavior isn't adopted, why it's not happening, where we would like to happen. But if you do, then it will be worth it, because that will lead to more sustainable change, and long-lasting change. And finally, I'm sure you've heard about evaluating everything we do, and that idea of building in evaluation from the start. And it sounds like a daunting kind of process, or it did for me for many years when I started doing research into this. But the way you define the behaviors is with that evaluation in mind. So if you don't know how you're going to know whether it's happened, then you probably need to reframe what you're trying to achieve. So can we go to the next one? Do I have another one? I don't have another one. This is it. Okay, I'll stop talking now for a second, but I'd love to hear your thoughts, does anybody disagree with any of this, any challenges? That would be amazing. And then I'll come back to some of the points that you've put in the chat.
Sabina, thank you. Just as people, if you can raise your hands if you want to ask a question, you want to explore something, you've got a point that builds on what Sabina's said. Just Sabina, thank you. That's, we're doing a bite-sized piece of awareness training here. This is obviously a very large and complex area. There are so many rich questions and requests in the chat. Quite a number are framed, and I've grouped them into one, so forgive me, there are about 6 different people wanting to understand more about sustainable change in detail and how to use it. And one particular comment or question wanting to understand tips for implementing change positively and minimising negative impacts for people. So if I can just take Chair's privilege, if I may, just for a second, as hands are raised. For me, when we look at the context of behavioural change, when we're working within a health and care system and wider, we tend to be talking about projects, distinct projects that we are doing. So perhaps it's looking at rollout of COVID vaccines, or it's looking at, asthma diagnosis. So if we look from the context of the project that we're doing, and we look at how do we make sustainable change, for me, we're actually reverse engineering and looking at stakeholders. We're looking at who we're working with, the population we're looking at, and actually understanding where folk are coming from so that they understand what we're doing. So I'm just opening that up to the floor as an observation and your thoughts, please, Sabina.
Yeah, absolutely. I think it's difficult for me not to kind of end up saying the same line over and over again, but absolutely is understanding who your stakeholders are and who needs to do what for your desired change to come into place. I'll give you another example, because I appreciate I'm talking very, very theoretical. We're doing in this very current job, in my very current role now, we're doing a piece of work on sleep, so sleep hygiene at population level, and we're doing this across the life course, and in trying to get people. So my target behaviors are around sleep hygiene, so putting your phone down half an hour before bedtime, not drinking, smoking in bed, that those having comfortable sleep environment, those sorts of things. And once I grouped the population into age groups of babies, children, young people, working age adults, older, shift workers, for each of those, there are about 6 or 7 actors that need to do things slightly differently to increase that good sleep hygiene across the population. So if you take working age, for example, work adults. You have themselves, but also their the people they live with, so partners, spouses, housemates. Workplace needs to be on board. Then you have healthcare professionals, so GPs, prescribers, non-clinical staff, and so on. So there are actually a lot of stakeholders, which is why I'm saying it takes a long time to map that and try to understand. I find it quite reassuring and validating. So a lot of time when I'm stuck in a working group or a board or a big partnership, and I keep saying, oh, we need to do this and we need to do that, and nobody does it, and then I'm sat by myself kind of do it and thinking, oh, such and such partner hasn't done such and such thing. I find it quite validating to think actually it's probably because I've never really explored what needs to be in place for them to do what I need them to do.
I think that's really helpful, and as we haven't got any hands raised, we just spend a couple more minutes, and I'll take Chair's privilege to. I've scribbled down from some of the points in the chat. When we're looking, I've talked about, I've raised about stakeholders. When we look at change management, it's also about understanding. Depending on the project that you're doing, if you're influencing a change, a service is shutting because you're doing a leaner approach and there's more centralized service, when you're engaging your stakeholders, depending on the individual and how or what their role is, will depend on the responses that you're going to get. So it's almost that bit of where you're taking the time in your project to do the engagement piece, engaging with all your stakeholders, both those that are key policymakers, those that are the population it directly affects, those that are influencing and on the outside. So considering everyone and considering the perspective they're coming from, so standing in their shoes and thinking what will they be thinking? Is it that they're concerned about losing their job? Is there an impact on the service, lack of ED in a particular area, the bus route in a rural village, for example? So each time, if we're thinking from that really considered perspective, thinking about an engagement piece, we can look at the change, behavioural change, and understand more about what we could do differently. So picking up on the sustainable, I think it is, and Sabina, do correct me if you feel otherwise, I think it is very much about considering the project that you're doing, taking the time to do a stakeholder piece, and looking at the behavioural change science to understand where folk are coming from, to try and get a positive change that hasn't, I'm picking up on someone's comment, a positive change that has got minimal impact. You're trying to bring people along for this piece of work you're doing. So over to you.
Yeah, yes, absolutely. And I think that's really hard, and that takes a long time, and it's often it might be that you will come to the conclusion that you have identified barriers, and actually sometimes there's not a lot that you can do about some of those. The way that we have to prioritize time and resources and our capacity sometimes will just make some of that really hard, if not impossible. But absolutely enacting change while minimizing impact, I think, is really, really important. But there's also an element of understanding what that impact is.
Absolutely. Thank you. I'm just mindful of time. Do you want to go to your next slide, Sabina, and then I'll quickly round this up?
Yes, very quickly. So these are some of the papers, the original papers that have informed what I've been talking about. They are very interesting and very well written. There are some training, some e-learning for health has some training in behaviour change and behaviour science. And again, this is about doing it in a kind of innovative way, not so much trying to change one little behavior for one person. It's about how do we put big programs in place? How do we get organizations to change a little thing that they do, and so on. So they should all hopefully be open access papers. I'm sure I have checked, but there are all sorts of other resources out there on the COM-B model behavior change wheel, which is the theory that I've introduced today.
Thank you very much. Thanks, Sabina. Right, next slides, please. Or next slide, I beg your pardon. Just really quickly, just want to promote the Dorset Innovation Hub website. That's a public website. Someone's just asked about, can the links be shared in the chat? We're going to share it with you after the event. So you'll get the slides, the link to the YouTube video as well, which I'll put up in the next couple of days for you. But just to think about the resources that are there available, about the community of practice, key documents are case studies, training opportunities wider, including, thanks Emily, that's really appreciated, and including some of the newsletters and blogs that we've got. Next slide, please. And just to say that in participating with this community of practice event, we will automatically include you in our community of practice space, which is on Future NHS. So all these documents will be available for you to have a look at. And there's a chat functionality, which you can also use as well. By default of the email that you will receive as part of this after event communication, you have the right to obviously be able to say if you don't want to join. We just got a really quick poll before we evaluation before we round up, and I've just got a couple of reflective points. So Emily's put in the chat, if you can just see there's a poll there that's live. It's an evaluation of the event. So if you could just complete that, everyone should be able to see that. Emily, if you could just double check that link's gone in. It's mindful. There's an interesting comment as well, just as that's loading. Can everybody see the evaluation poll? There should be a number of questions coming up. Anybody shake heads or nod? No? Emily, if you can pop the poll in the chat again, that would be lovely. Thanks, Judith. We're just going to try and get that to you. Jamie's saying in the chat, remember that it takes on average 66 days to establish a new habit. Making change happen sustainably really takes time. And I totally and utterly agree with that. Really profound comment. Thank you, Jamie. Here's the poll. It's just coming through. So you've got 6 questions. A couple of them are free text. So please do put your thoughts in there, and I'll just go then to the final comments in just a sec. And Emily, if you're all right to put the last slide up, that would be brilliant. Thank you. If as many of you could please complete that evaluation. It's a mini evaluation. It will literally just take you, well, ideally 1 or 2 minutes. It depends how quickly you're doing free text, but should be really very short. So 3 responses so far. So just as we're closing and while you're thinking about your evaluation points, and thank you, I just want to pick up on Jamie's point. Behaviour change takes time. It's about habits. It's about understanding what we are trying to do. So we at the Dorset Innovation Hub are seeing this as a start to the conversation. So huge thank yous to Sabina for exploring in a bite-sized way behavioural change and how we can look at sustaining that change and sustaining it in a positive manner for individuals, for everyone involved. with negative impact. Start of the conversation. So if you do join us on Future NHS in the future in that community of practice, please do post questions and we can have discussion. We do, with all community of practice sessions, offer a 30-minute drop-in session. So if you'd like to join us, Tuesday the 2nd of April, it will be in the email that you get after the event. Tuesday the 2nd of April at 11:30 is an open, informal opportunity to have a discussion. So you might want to talk about a certain framework, you might want to talk about a certain project you're doing, you might want to just explore a little bit more about what does behaviour mean and what are stakeholders. So whatever it is you would like to talk about. So 2 minutes to, if we could take that last slide down, thank you. Huge thank yous for joining us today. So on behalf of the Dorset Innovation Hub, thank you, thank you, thank you. And Sabina, thank you for your input. Really, really appreciated. And look forward to discussing more over the coming days, weeks and months. So wishing you a lovely rest of your afternoon and look forward to catching up soon. Bye, bye, bye.
Thank you very much. Thank you, everyone.